there, I'm Dr. Soni Sierra. I'm a reproductive endocrinology and infertility specialist, and today we're going to be talking about assisted reproductive technology. We know that about 1 in 6 couples experience infertility, and infertility refers to the inability of a person or couple to conceive a child after trying for a certain period of time, which is actually age dependent. And we know that infertility can be caused by a variety of factors involving the female and the male partner, and therefore both members of a couple are important to consider when diagnosing infertility. Assisted reproductive technology, or ART, refers to medical procedures that are used to help individuals and couples conceive a child. ART procedures involve the manipulation of eggs, sperm, or embryos outside of the body. ART can also be used outside of a diagnosis of infertility to help same-sex couples or single individuals have a pregnancy to term. And we'll be looking at them today in 3 distinct categories. One is in vitro fertilization or intrauterine insemination. The second is fertility preservation or freezing eggs. And third is using third-party options in ART, such as gestational carrier or surrogacy. IVF stands for in vitro fertilization, which is one of the most well-known and well-discussed procedures in ART. Specifically, the process involves stimulation and removal of eggs from ovaries, after which point they're fertilized with the sperm in a laboratory setting. Once fertilization happens, the fertilized egg or embryos are allowed to develop under ideal circumstances, and then the resulting embryos, either one or more, depending on the case, are transferred into the uterus. So intrauterine insemination, or IUI, is a less invasive procedure compared to in vitro fertilization. It involves washing and preparing the sperm outside of the body in a laboratory environment, which are then placed directly into the uterus above the cervix. The idea behind the intrauterine insemination is to increase the likelihood that sperm will reach the fallopian tube and therefore increase the chance of fertilization. The next application of ART is in the consideration of fertility preservation. Egg freezing, also known as oocyte cryopreservation, involves the stimulation, harvesting, and freezing of a woman's eggs or oocytes for later use. The idea behind egg freezing is to give women the ability to preserve their fertility for the future. Egg freezing involves removing eggs after stimulation from a woman's ovaries and then freezing them in the lab. Later on, when people are ready to use those eggs, they would be thawed and fertilized in a procedure similar to in vitro fertilization. It's really important to note it's not an insurance policy that you can call on later to 100% predict you'll have a child. Another form of the application of assisted reproductive technology is when we employ surrogates or gestational carrier. This is a technique or technology that we use when couples are infertile and unable to carry a pregnancy to term, or they might have a high-risk medical condition that prevents them from having a healthy pregnancy and delivering at term, or if they're same-sex and a uterus isn't available for carrying a baby. Gestational surrogacy is a complex and emotional process that does involve many legal and medical considerations. There are specific requirements by Health Canada for intended parents and surrogates to meet to ensure that the process is safe and legal. So while ART is an amazing technology that can be used to help people create the family of their dreams, it is a costly procedure, and the lack of insurance coverage, especially in Canada, often creates barriers and makes the process inaccessible. Because of the costs involved and the medications and the procedures and the monitoring, it is a very physically and emotionally demanding procedure and associated with a certain degree of uncertainty. So there's a very important role for a large and multidisciplinary care group involved in delivering ART. The other issue is that for same-sex couples, difficulties present when trying to find egg or sperm donors that are a good match. In Canada, there are strict Health Canada guidelines and legislations in place that are meant to guide the process of third-party reproduction, but sometimes can make it a difficult and stressful procedure. The most important thing is that patients who are undergoing ART lean heavily on their doctor and other members of their multidisciplinary care team. The advice is not to go at it alone. So today we talked about ART, and we went into detail about IVF, IUI, egg freezing, and surrogacy. We know that ART has helped thousands of couples and individuals achieve a pregnancy and build the family of their dreams. It is still a costly, complex, and emotionally demanding procedure, and it may carry some risks. And importantly, as much as we'd like it to be, it's not a successful outcome for everyone. Thank you everyone for watching this video on ART, and check out more information on women's health education made simple infertility series now on social media platforms like Instagram. Bye for now.